Why is fibromyalgia hard to diagnose and find treatments? Well, I will tell you that it's actually diagnosed quite a bit. When patients typically didn't fit into the conventional model of, well, they don't have rheumatoid arthritis, they don't have lupus, or these titers are coming back. Some of them starting to look a little positive. Patients have pain, they have mood changes, they have the pains on the trigger points, all the fibromyalgia, insomnia picture. Then they start going, okay, well, this patient I think has fibromyalgia. That is not telling us anything. It's telling us that we don't know what the cause is. That's what we see happening in the conventional side of medicine is these patients have neuropathies, they have sleep disturbances, they have pain, trigger point pain, etc., and some digestive involvement, and etc. So when they have these problems, the answer is Lyrica, pain medication, neurological drugs. That's not the cause of the problem. On the integrative side, what we have seen working with patients over the last decade for 17 years is that patients have usually subacute infections. And I know that might sound strange to you. What do you mean I have an infection? Wouldn't my doctor be able to pick that up with a basic CBC chemistry? And the answer is no, because these are unique viral bacterial infections that require specialized testing, not a basic, it's not like you're going to get a fever with these types of, these are low-grade infections, and they're causing inflammation and releasing neurotoxins that are causing problems in the body. Now, I'm saying that because this is the patient base we've seen over 17 years. Now, there may be doctors that see a different patient base where their fibromyalgia causes may be different, but this is what we've seen. And when we treat those things, that's where we see success. So every patient is what we like to call N of one, different. You have to build the treatment on them, the clinical trial on them, on their symptoms, on their laboratory data, and then get to the cause of that fibromyalgia so that you help them. Now, we have this great video on fibromyalgia, which goes into so much more detail, breaks down potential causes, the approach that we like to use, laboratory diagnostic and treatment, and I welcome you to reach out and we can send that to you if you'd like to learn more about that. But I want to thank you for asking that question because many patients are frustrated. They have fibromyalgia, they've been told they have it, and really what that means is they don't know what you have. They know that you have inflammation, sleep disturbances, neurological problems, and they don't know how to treat it. And so my answer to that is find the cause, be investigative, get deeper, improve the nutritional deficiencies, get rid of the infectious causes, rebuild, get rid of the chronic inflammation, and the symptoms will follow. That's what we've seen in our years of experience. Thank you for asking that question, and I hope that this has been helpful.